The blood had already soaked through the trauma surgeon's gloves when the young woman stepped forward and told him to stop pulling the needle. Nobody in the room knew who she was, and nobody had asked her to take control, yet the certainty in her voice made the chief surgeon freeze with the needle suspended above the wound. The patient on the table was deteriorating fast, his blood pressure falling while alarms sounded in sharp, relentless bursts across the emergency bay. Around them, nurses moved with practiced urgency, instruments changed hands, and physicians called out numbers, but the young woman seemed strangely untouched by the chaos. She stood in plain hospital scrubs with her dark hair pulled tightly away from her face, no jewelry, no makeup, no visible sign that she belonged anywhere near the center of the crisis. She had been working as a surgical assistant for only 3 months, mostly preparing instruments, checking supplies, and staying deliberately invisible. Yet now her eyes were fixed on the wound with the cold concentration of someone who had seen this kind of injury before. The chief surgeon, Dr. Elias Mercer, had spent 28 years learning how to recognize competence, arrogance, fear, and panic in an operating room. He knew immediately that the woman was not guessing. She pointed toward a tray without looking at it and asked for a specific curved needle. The scrubbed nurse hesitated for half a second before handing it over. The woman took it, leaned over the patient, and began stitching. Her movements were fast but never hurried. Each pass of the needle was deliberate. She placed pressure exactly where it was needed, changed the angle of her hand, and adjusted the tension before the next stitch. Dr. Mercer watched without speaking. Something about the technique bothered him. Not because it was wrong. Because it was too precise. It was the kind of precision developed when mistakes were measured in seconds rather than grades. The patient had arrived after a serious accident, carrying a deep abdominal injury that had caused internal bleeding. The hospital team had stabilized him as best they could, but one damaged vessel continued to create a problem. The woman recognized the pattern before anyone else did. She did not ask for permission. She did not explain herself. She simply worked. When the final stitch tightened, the monitor began to steady. The frantic beeping slowed. A nurse released a breath she seemed to have been holding for an entire minute. Dr. Mercer looked from the patient to the woman. Her gloves were stained, her breathing controlled, her expression unreadable. She removed the needle and stepped back as if nothing unusual had happened. Then the chief surgeon noticed the scar. It was small and pale, partly hidden near her wrist where the cuff of her scrub top had shifted. He had seen scars like that before. Not from ordinary hospital work. From years of equipment, field medicine, and conditions where sterile technique depended on whatever could be carried into a place that was never designed for surgery. He looked at her identification badge. Lena Ward. Surgical assistant. Nothing else. No advanced credentials listed. No military designation. No explanation. Dr. Mercer asked where she had learned that technique. Lena lowered her eyes toward the patient. She said she had learned it a long time ago. He asked where? She did not answer. One of the residents gave a nervous laugh and suggested that perhaps she had simply watched enough procedures to develop good instincts. Dr. Mercer did not laugh. He had watched thousands of surgeons work. He knew the difference between someone copying a technique and someone remembering it from experience. Lena had not looked at the wound like a student. She had looked at it like a map. The room gradually returned to normal. The patient was transferred towards surgery for further treatment, and the staff began cleaning the trauma bay. Lena quietly removed her gloves and dropped them into the disposal bin. She was already turning away when Dr. Mercer stopped her. He asked her to come to his office after the patient was stable. Lena paused. For the first time, something changed in her expression. Not fear exactly. Recognition. As though she had known this conversation would eventually come. Hours later, the hospital corridors had grown quieter. The bright urgency of the emergency department had softened into the muted rhythm of a night shift. Lena sat alone in the staff room with a paper cup of untouched coffee between her hands. She had chosen this life carefully. A small apartment. A simple job. No questions. No old photographs. No stories about where she had been before the hospital hired her. She had spent years making herself ordinary because ordinary was safe. Dr. Mercer entered carrying a thin folder. He did not sit immediately. He studied her for several seconds, then placed the folder on the table. Inside were photographs from the trauma procedure, notes from her employment file, and a list of credentials that did not match the woman sitting in front of him. Lena's military history was almost completely absent from the paperwork available to the hospital, but one detail had slipped through an old background check. A classification code. A medical training designation. Dr. Mercer had seen it before. Not often. Never attached to someone working as a surgical assistant. He closed the folder. He told her that what she had done in the trauma bay was not ordinary surgical assistance. Lena said nothing. He asked if she had ever worked in combat medicine. Her fingers tightened around the paper cup. He asked if she had operated under conditions where evacuation was impossible. Still nothing. Then he asked the question more quietly. Who trained you? Lena looked toward the dark window. For several seconds neither of them spoke. Somewhere beyond the office, a monitor beeped steadily, reminding them that patients were still waiting, that life continued whether old memories were ready to return or not. Finally, Lena turned back toward him. Her voice was calm. She said one word. JSOC? Dr. Mercer stared at her. The room seemed to become smaller. He knew exactly what that meant. And suddenly the woman he thought had been hiding an impressive past was hiding something much heavier. Something that had followed her all the way into this hospital. The question came before the doors had even finished closing behind the next ambulance. Dr. Mercer stood at the trauma desk, watching Lena move through the emergency department with the same quiet efficiency she had shown the night before, but now every movement looked different to him. He no longer saw an unusually capable surgical assistant. He saw someone trained under circumstances where hesitation could become fatal. The new patient was a middle-aged construction worker who had fallen from scaffolding and arrived pale, confused, and dangerously unstable. His blood pressure was dropping again. The trauma team rushed him toward the treatment room while nurses called for blood products, and the attending physician began assessing the injuries. Lena stayed back. She did not volunteer. She did not interfere. Dr. Mercer noticed that restraint immediately. Someone with her training would have been capable of taking command, yet she deliberately kept herself in the background. He wondered how many years she had spent learning when to speak and when silence was safer. Then the patient suddenly deteriorated. The monitor changed. The room erupted. Dr. Mercer ordered immediate intervention, but Lena looked toward the patient's abdomen and quietly said there was another problem. He asked what she saw. She pointed to a subtle change in the patient's breathing and the tension beneath the dressing. Dr. Mercer understood. The first injury was not the only threat. Something deeper was happening. He ordered the team to prepare for emergency surgery. Lena stepped forward only when he asked her to assist. She moved with the same controlled precision as before, but this time Dr. Mercer watched every detail. She anticipated instruments before they were requested. She adjusted pressure without being told. She recognized the complication seconds before it became obvious. There was no drama in her movements. That was what disturbed him most. She had learned to remain calm when everyone else was afraid. The operation became a race against time. Blood loss increased. The room grew quieter. Instructions became shorter. Nobody wasted words. Then the patient began to crash. Dr. Mercer reached for the damaged vessel, but the bleeding obscured his view. Lena saw something he could not. She told him where to look. He followed her direction and found the source. For a moment, the entire room seemed to stop. Lena held the tissues steady while Dr. Mercer repaired the damage. The patient's numbers slowly began to recover. Nobody celebrated. They were too exhausted. Lena stepped away from the table and stared at her hands. Dr. Mercer noticed that she was trembling. Not during the crisis. Only afterward. He asked if she was all right. She nodded. He knew she was lying. He waited until the room emptied. Then he asked what had happened to her in JSOC. Lena said she was not supposed to talk about it. Dr. Mercer told her he was not asking for classified information. He was asking because he needed to understand why someone with her experience had chosen to disappear into a hospital job where nobody knew her history. She looked at him for a long time. Then she said she had not disappeared. She had survived. The words landed harder than he expected. She explained that years earlier, she had been part of a medical team supporting a special operations unit. Her job had never been to fight. It had been to keep people alive long enough to reach help. But one mission had changed everything. Their evacuation route collapsed. Communications failed. Several people were injured at once. She had been forced to make decisions no medical textbook could prepare her for. Dr. Mercer listened without interrupting. Lena did not describe the violence or the battlefield. She did not need to. Her silence carried enough weight. She told him that afterward, people had praised her for saving lives. They had called her exceptional. They had written reports about her judgment under pressure. But she remembered only the person she could not save. Dr. Mercer asked whether that was why she left. Lena shook her head. She said leaving was not the hardest part. The hardest part was realizing that everyone around her wanted the story to become something simple. Hero. Survivor. Failure. None of those words fit. She had made a decision that night. A decision that saved several people but meant abandoning someone she had promised not to leave behind. She had carried that choice ever since. Dr. Mercer finally understood why she refused recognition. She was not hiding because she was ashamed of her abilities. She was hiding because praise reminded her of the cost. He began to speak, but Lena stopped him. She said there was something else he needed to know. Before she could continue, a nurse rushed into the room. The patient from the operation had suddenly developed a dangerous complication. Dr. Mercer and Lena returned to the bedside. The patient's condition was worsening again, and the team could not immediately determine why. Lena studied the monitor, then the patient's hands, then the surgical site. She recognized a pattern that brought back something she had not thought about in years. She asked Dr. Mercer to look at the medication chart. He did. Nothing seemed unusual. Then Lena noticed a small notation beside one medication. Her expression changed. She told him the patient might be reacting to something that had been administered before surgery. The chief surgeon checked the records again. The medication had been entered correctly, but the dosage was wrong for the patient's condition. Someone had made a serious error. The room fell silent. Dr. Mercer looked at Lena. She was already moving toward the patient. She had recognized the danger because she had seen the same kind of mistake before, in a place where there was no second chance. But the revelation was bigger than the medication error. When Dr. Mercer reviewed the original records, he discovered that the same physician who had made the mistake was the person responsible for reviewing Lena's old military medical file. And suddenly he realized Lena had not simply walked away from JSOC. Someone had helped make sure she disappeared. The name on the old file was one Dr. Mercer recognized immediately, and for several seconds he could not bring himself to look at Lena. The physician who had reviewed her military record years earlier was now a senior administrator at the hospital, a man who had spent the past decade building a reputation for flawless judgment, while quietly ensuring that Lena's history remained buried. But the truth was not what Dr. Mercer first assumed. Lena had not been removed because she was dangerous. She had been protected because she had refused to let a painful decision be rewritten as someone else's failure. The mission that ended her military career had involved a medical evacuation under impossible conditions. When the team came under pressure, Lena had been forced to choose between two injured people who could not both be moved immediately. She chose the one whose condition could still be stabilized, then returned for the other as soon as help arrived. She had saved several lives, but the person she returned for did not survive. The official report later reduced the event to a series of technical decisions. It never recorded the hours Lena spent afterward trying to understand whether another choice could have changed the outcome. Her commander had recommended her for recognition. Lena refused. When the administrator discovered that she intended to leave, he quietly arranged for her records to remain restricted and helped her begin again under a simpler professional role. He had believed he was giving her a chance to disappear from a world that had consumed her. Lena had interpreted it as another kind of silence. Now, years later, Dr. Mercer understood the difference. She had not needed someone to erase her past. She had needed someone to believe she could carry it without being defined by it. He found Lena outside the treatment room, standing beside a window as morning lights slowly entered the hospital. He told her he had seen the file. She did not turn around. He told her he knew the truth now. She asked which truth he meant. The one about the mission, the one about the hidden records, or the one about why she had been stitching wounds in a hospital while pretending she had never done anything more complicated than assist a surgeon. Dr. Mercer said all of them. Lena finally looked at him. There was no anger in her face. Only exhaustion. She told him she had spent years believing that if nobody knew what she had done, then nobody could ask her to become that person again. Dr. Mercer told her he would never ask. Then he showed her the patient's updated chart. The construction worker was alive because she had recognized the medication error before it became irreversible. The same instincts she had tried to bury had saved another stranger. Lena looked through the glass toward the recovery room. She said she did not know whether that made the past better. Dr. Mercer answered that it did not have to. Some things could not be made better. They could only be carried differently. The words stayed between them. Later that morning, Dr. Mercer called the hospital administrator into his office. He did not expose Lena's classified history or turn her into a story for the staff. Instead, he confronted the medical error and demanded accountability through the proper channels. He also asked Lena what she wanted. She expected him to recommend a promotion, a military liaison position, or some formal recognition. Instead, he asked whether she wanted to continue working in surgery. Lena looked surprised. He told her that her past belonged to her, and whatever came next should also belong to her. For the first time since arriving at the hospital, she did not answer immediately. She thought about the trauma bay, the patients, the young residents who were still learning, and the strange feeling of using skills she had once considered a burden. Then she said yes. Not because she wanted to return to who she had been, but because she finally understood that she did not have to. Weeks later, Lena began formal surgical training at the hospital. She still kept her past private. She still avoided praise. But she no longer lowered her eyes whenever someone asked where she had learned to remain calm under pressure. Dr. Mercer never asked her to tell the story again. He simply made sure the younger surgeons understood one thing. Skill could be taught. Technique could be practiced. But compassion under pressure was something people either protected or lost. One evening, after a long shift, Lena stood alone in the same trauma bay where everything had begun. The room was quiet now. The lights reflected against polished steel. The empty operating table no longer looked like a battlefield or a memory. It looked like what it had always been. A place where someone arrived broken and another person tried to help. Dr. Mercer walked past her and stopped briefly. He did not mention JSOC. He did not mention the scar on her wrist. He simply said that the patient from that first night had gone home. Lena smiled faintly. It was the first time he had seen her do it. She looked toward the empty room and whispered that she was glad. Then she returned to work. Because sometimes the bravest thing a person can do is not return to the life that made them strong, but build a new life where that strength can finally be used without fear. And perhaps that is what healing really means. Not erasing the wound, not pretending it never happened, but learning that the scar can become part of the hand that helps someone else stand. If this story reminded you that a person's past may hold pain you cannot see, share it with someone who needs that reminder, because sometimes the quietest people in the room are carrying the greatest reasons to keep helping others. And long after the hospital lights faded into the darkness, Lena's hands remained steady, no longer because she had forgotten what they had survived, but because she had finally learned what they were meant to save.